And I may just take a minute to also remind folks that oftentimes when a clinician is asking about sleep, there is often a misconception that older adults need less sleep.
Oh, I hear that all the time. I don't need as much sleep. 4 hours, that's all I need.
Exactly, and that is, of course, a myth, because we know that, of course, they're very sleepy, despite getting little sleep and indicating that that's sufficient for them. And the other thing is that conditions like restless leg syndrome and periodic leg movements are often confused as being the same. And we just saw a gentleman who was treated for restless leg syndrome, whereas in fact the patient just said that they were kicking their legs at night. Those are the periodic leg movements. The restless leg syndrome, it's interesting. It's a clinical diagnosis supported with findings of leg movements, and folks often fail to differentiate between the two. And the other thing is that snoring, when any type of noisy breathing in my, as I go through the inventory of sleep questions, any type of noisy breathing is abnormal, and certainly if the patient wakes up with morning headaches. And this is why we often ask patients how they feel in the morning. How long does it take them to really get going? And if that period is prolonged, that may point to disrupted sleep or poor quality sleep at night.
So a clinician doesn't necessarily always have to look at apneic episodes. Snoring would be enough for you to be concerned.
Snoring, and if the finding on physical exam shows that there is a restriction of the airways, and interestingly, snoring, apneic spells, certainly daytime sleepiness, but also nocturia, which is a huge issue, especially in older adults with dementia. And also the fact that they may experience more rapid cognitive impairment. They may experience more issues with cognition, particularly in the morning, that tends to clear up as the day goes on. And oftentimes, sleep apnea presents very differently in an older adult than in a younger person, because they often are not working, and they may take naps when they need to. And so impairment in job function may not be the pushing or the motivation for the patient to really see a clinician.
But worsening of cognition is.